Fantastic. So ICHRA opportunities with ICHRA Health. Put your questions in the question box. We'll get to those questions at the end of the presentation. And the next slide. Okay. The dynamic duo of the individual market right here. Say hello, Brad.
Hello, everyone, and hello, Brad and Andy. By the way, we did a seminar yesterday called Two Bald Guys, and that's the reason why. Just FYI.
Get it? Two bald guys.
It was pretty fun. It was going to be
It
our
was
future
fun. We got a lot of good feedback.
podcast. It was good. It was good.
The feedback was very
All
positive.
right, go
Yeah,
ahead, Jeff.
there's our
I'll let
contact
you.
information. Check us out on social media as well. Take it away, Andy.
Perfect. Thank you, gentlemen. I will go ahead and share my screen here, Brad.
Let me stop. Let me stop sharing and hand it
Kill
over to
my
you.
camera. Save some bandwidth.
Yeah, we don't. I don't think we have a good deal of people on, just not as many as we did yesterday. But shouldn't have the audio issues we did yesterday. So Andy, take it away. I think you're up or will be up. You're presenting,
Yeah,
right?
looks
Oh,
like
sorry. There you
not
go.
yet.
Sorry, I had to click again. Sorry. Now you
No, you're
should be.
fine.
And by the way, everybody, while Andy's getting queued up, he woke up very early this morning to be with us and look as good as he does because he's out of the Phoenix area. So we're really happy that he makes us important enough to wake up at 5 o'clock in the morning. He probably already exercised, good stuff like that. So Andy, go for it.
Thanks for the flattering me there, Brad. All right, awesome. Well, I appreciate you guys having me, of course. Nice to be on the call with everyone today. As mentioned, gonna kind of go from the angle of what Oscar is doing about this emerging market, obviously known as ICHRA, which many of you are familiar about, especially in the Ohio market. Of course, market has been ripe for the product for some time. So we'll go through kind of what Oscar's doing about it, why we believe in it, things of that nature. But then, of course, I'm going to give a little quick recap of who Oscar is, especially if there's group brokers on here who are not typically using or talking about Oscar with their clients. And then I'll also just touch on our price position for 2025 here, as we obviously have some finalized pricing in place from probably the last time any of you were on a call talking about Oscar here. So we'll get right into it. I guess I just talked through the agenda, but we'll get right into it. My name is Andy Mueller, as mentioned. I actually lead our ICHRA sales team here at Oscar. I've been at Oscar for some time, though, managing growth in a few different capacities. But latest and greatest is this emerging market known as ICHRA. Very fun part to be a part of at this company, of course. I think this market has a lot to offer. I think there's a long way to go, of course, for it to be kind of that norm and not just a tool belt item for you guys, and more so something that is actually proposed to almost every group. I think it's going to get to that point where you're going to have the self-funded options that make sense for the groups that have the proper risk profile. You're going to have your level funded options. And I do think ICHRA is kind of going to fill in that fully insured option down the line as a small group. Risk pool just doesn't seem to cut it, and those increases are just not going to be sustainable going down the line. So we'll get right into it. So a quick recap on who Oscar is, what we're all about. So plain and simple, why are we here? Why are we doing what we do every day? And here's the mission we're doing. So of course we're building products and we're doing things every day to ideally drive a healthier life and making it more accessible and more affordable for all Americans. And that's the goal behind what we do, how we build our products, how we built our service model, things of that nature. Again, I don't want to spend too much time here. As hopefully many of you know who Oscar is at this point. But again, for those specifically working on the group side and not having access to Oscar, we're about just over a decade old at this point. Some people still like to say, "Aren't you just a technology company?" Which is comical at this point. But we are a technology company, and we've been bucketed with these insure tech companies. But now we're finally, getting the recognition and some of those flowers that show that, hey, we are a profitable insurance company. We're not going anywhere. We're not going to be bucketed with those companies that came and are no longer that many of us know about the last couple of years. So I think the biggest point here that I want to point out is not only are we a tech company, but we are a profitable insurance company at this point that is doing right by our members, and we'll get into how we're doing that shortly. But the big point here is the second paragraph on the left that I think is the most important, and why Oscar came to be. And that's really to build a company that behaves like a doctor and a family. We want folks to engage with us. We do not want folks to have the typical, I hate my insurance company, I do not want to pick up the phone and call them, right? That is the opposite of how we function, and we'll get into showing that we're doing it the right way, and our members think so as well. So just a quick background behind us. And now, looking at where we are today, and obviously you always want to have one hand in the present, one hand in the future, and where we're going to, look to go and what we're going to do, into 2025 and beyond. But where are we today? So you see here, we have the largest membership we've had since inception. We're now serving over 1.6 million members, which is essentially 1 in 14 ACA lives. So we are a top 3 ACA carrier. So of course, from the group side, when folks are coming from the group side to the individual market via ICHRA, ICHRA, things of that nature, even the names like an Ambetter of the world, who is the largest ACA carrier, is not, necessarily well known, and Oscar's in that same boat with some of those employees. So that's, I think, one of the biggest hurdles, but we have to show that, hey, Oscar is a top 3 carrier. We are here to stay. We are in a position of strength, and we want to make sure people are well aware of that. So you kind of see our footprint here on the right-hand side. We'll have a slide a little bit later that highlights it a little bit more in depth. So we get to that. This is what I think you'll see a lot about what I talk about and just what Oscar is all about. And for those of you who do not know NPS or Net Promoter Score and what that is, it's essentially the higher this number is, it's going to say the more likely your members and your customers are to recommend you as a business or company or product to their peers. And just to give an idea here, the average NPS in our industry hovers around 0. And to give you outside of the industry, a company like Apple, who is known for their NPS, hovers around 70, 72. So, this is something that we're very proud of, and it shows we are doing right by our members and we're doing things the right way. And this helps drive us to member retention. So the 83-84% member retention that we have is actually unheard of in the ACA space due to $0 membership. When you go from a $0 plan to a $5, $8, $12, $21 plan, being able to retain your members, it can be a feat, and we are doing things, and we do believe that's because of the experience that we offer outside of the innovative plans and individualized plans we offer to our members as well. So that's a quick, look into Oscar, why we do what we do, and why we believe we are continuing to have the success we are. I'd like to point out that NPS score that continues to go up is also going up as we scale, which is also a very promising stat, because of course, as you scale, it's a lot easier to lose and just drop down that member experience, but we continue to elevate that, and we're very excited about it. So getting into 2025, what's new, what's coming out, and then we'll get into a little bit more of the bread of this presentation. But we have expanded again in 2025. We have not gone into new states in 2025, so I'll make that clear. These are more so new service area expansions and new markets within the states that we are in, Ohio being one of those. But here's a quick look at that just to show we continue to expand. And I do expect state expansion as we go into 26 and beyond. But when it comes to how we continue to invest in ourselves, of course, ICHRA is going to be the main lever there that we'll get into here today. But some of the others are things like condition-specific plan options, and we'll touch on those. Spanish-led experiences for our members in that demographic. We always continue to update our technology and our broker portal for our brokers and consultants to be able to access their book of business, to enroll with ease and things of that nature. And then, of course, invest into making sure we have competitive products across our markets, and ideally $0 plans in certain markets as well. And that's, of course, mainly on the IFP side of things. On the ICHRA side of things, still driving to have plans that are going to fit the employee sponsored enrollee or employer-sponsored enrollee, more so than an IFP member, to make sure we're hitting both sides of the market there. And as I mentioned, this is the one of our biggest strategy levers of the next 3 years. If you hear our CEO Mark Bertolini talk about it, this is one of those levers that we continue to pull, and that we believe is really going to drive the next wave of population to the individual market, which is only going to help the risk pool even more than it is today at the record-breaking level it is today. So that's, we want to obviously talk about who Oscar is, especially for some group folks that may not work with Oscar today. But really, why does Oscar believe in ICHRA? What is ICHRA? We can get into that. I don't want to make this an ICHRA 101 by any means. I don't think I'm necessarily the one to do that. I think, working with an ICHRA administrator or vendor, things of that nature, is the right route to do that. However, I want to make sure high-level points are hit here, and then we'll get into why Oscar believes in what we're doing about it and how to access, the plans that we have offered for ICHRA enrollees. So at the end of the day, you've all heard the ugly acronym a bunch by now. I'm positive in that. But the individual coverage health reimbursement arrangement really is just an ugly acronym that's a simple concept, right? Employer gives tax-free dollars, well, depending on how the employee rolls, but the employer is going to have tax-free dollars given to the employee to access their health insurance, whether paying for premiums, whether paying for qualified medical expenses within that health wallet. It depends on how it's set up. Of course, there's a lot of different ways to do it, but it's a really simple concept behind it, taking those dollars from their employer and buying the plan that they want. Of course, the ACA is the fastest growing segment in the country, and we want to help drive that even more by getting some of that employee risk pool that's currently under a group sponsored health plan into the ACA as well, which is going to only do exactly what we want it to do, which is increase stabilization, keep rates where they're at, hopefully drive more competitiveness in the market as well. And then at the end of the day, it drives employees to be able to, take control of their healthcare. They understand the plans and the options they have a little bit better because they are now consuming it for themselves. They're not just being told, hey, we got the low, medium, and high deductible plan. Go ahead and pick what's best for your family. When in reality, most likely, it's not going to be the best fit for their family comparing to the hundreds of options they have. And we'll get into that, of course, in terms of choice overload and things like that. We want to make it as easy as possible for members to understand, hey, this makes sense for my family, and it's actually cheaper than it was, or hey, it's going to drive affordability through the plan. And there's a lot of different ways we can do that. So quick look, of course, just want to point out, hey, there's just another option. And this goes back to my point. When we're coming to a table with a group, you have your options, right? Now this is another option that needs to be presented. Ohio is one of the markets that it's very competitive, and that's going to make sense to be on a lot of the spreadsheets as, hey, here are your options and solutions for your health plan this year as an employer. So why do we believe that this is going to even drive any membership to the ACA market? This lots of numbers here, right? And I know a lot of you are probably much smarter than me on this call, so you might be able to digest it real easily. The quickest thing I want to point out here is the middle two light purple boxes. That's showing the 75 million lives that are sitting within the under 1,000 employee market today. So do we think we're getting 75 million members to move to the ACA? Absolutely not. However, I want to point out here that even if we tap 10% there, so let's say we pull 7.5 million lives over the next couple of years over to the ACA within this risk pool, that's going to drive that traditional ACA market that we see on the bottom left. It's going to increase it by 35+%, right? So that instantly drives, again, more increasing stability to the ACA. It's going to help folks be able to pick plans that make sense for themselves and their family, and help that distributed workforce that we continue to see with remote work and plans that make sense for employees that live all over the place. So again, this is just a quick look into, hey, this is kind of where we get some of the numbers behind why we believe we can drive a meaningful membership to the ACA from the traditional group chassis as we see it today. When it comes to how the ICHRA functions and why that makes sense for employer and employee, we just had these two quick little looks here. But really for the employer, let's say they got a small, medium-sized business, they continue to see those rate hikes over and over again, and their budget, they just don't know what to do with it. They're like, this is getting out of control. Well, you bring in the ICHRA plan over the status quo, right? They can drive, their flat year over year, or they can have their trend increase that they know ahead of time. They can budget ahead of time. And it makes a lot of sense. And of course, a lot of times, depending on the market, we can see savings. And there's a societal shift. There's some talk that needs to happen with this change management to make it make sense. But it can really benefit the employer, as you see. But then on the right-hand side, the employee, instead of choosing that low, medium, high deductible plan that we've talked about, they get, depending on the market, again, we don't want choice overload. So we're going to help drive them to a plan that makes sense with the doctor they want to see. Maybe they have a specific condition that they're managing. How do we help drive them to the right plan? So as the example says here, Rebecca has 118 plan choices. Wow, that's a lot. We only had 3. Now we have 118. I don't know what the heck I'm going to do with all these plans. However, she knows that she's, going to see X, Y, and Z doctor. She's managing diabetes. Oh, there's a diabetes plan offered from Oscar that can help me cap my insulin, that can help me have $0 exams for, foot exams and eye exams and, things that are going to help manage this condition. And those are going to make sense, whether that's with Oscar or another carrier. The beautiful thing about ICHRA, right, is that these folks get to choose the plan that makes sense for them, no matter carrier in the market that makes sense. So, you saw Oscars in 18 states. If they happen to be in one of the states Oscars not, they're still going to have an option on the individual market that's going to make sense. And really, that's the beauty of how folks are going to access their healthcare in the future. When we get into what we're doing, so outside of partnering with ICHRA admins, which is a lot of what I'm doing every day, is working with all these admins and vendors. I'm sure you heard of them, several of them, as there are a lot of them out there today. We're obviously driving competitive pricing plans. We're innovating on our plan designs to make them more individualized, as I mentioned with the diabetes plan on the last slide, but we'll get into in more depth. But we are building, bespoke off-exchange plan portfolios. So we have 4 markets where we're doing that today. Ohio is one of those. You can see the kind of the teal colored in our footprint on the map on the left. You'll also see on the bold below the map are really the states that I expect true competitiveness in 2025. So I wanted to give a quick visual here. But outside of the 4 off-exchange portfolios that we have built, they're expanded portfolios. Every state, all 18 of them, we do have our mirrored plan options off exchange available for ICHRA enrollment. Obviously, working with Cornerstone or any ICHRA administrator that maybe works best for your business. I know Cornerstone has some recommendations that they work with. If there's one that makes sense for your business or you have a question about, I'm happy to obviously chat about it. But there's a lot of different options. A lot of them do things a lot differently. So you want to make sure you're working with one that, works with your business. And I know Cornerstone's vetting properly to make sure you guys have access to proper ones when working with them. And this is a quick
Andy,
look at that. Yeah, go ahead.
quick interruption.
Yeah.
The New Jersey looked like New Jersey and Long Island. So
Yes, sir.
which is it there? Is it
Yes.
sort of like Metro New York area?
No, it's going to be New Jersey. Great question. We can get into. So essentially, Florida, Georgia, New Jersey, and Ohio are the expanded off
Yeah,
exchange portfolios.
right.
And so it depends on the market. New Jersey's, there's some pending plans there still, to be honest with you. State-based exchange is taking a little bit longer. The other 3, it's about 14 to 17 plan options that are extra on top of the typical mirrored plans. And these off-exchange plans, Brad, and it's a great question. These off-exchange plans I'm going to get into here shortly, and I'll just jump to it here. So in Ohio, for example, there's 16 new plans. Keep in mind we have 2 products in Ohio, right? We have the Cleveland Clinic product and we have the Oscar product down in Columbus, Cincinnati area. These products are separate, right? You can't access the clinic if you're on the Columbus Cincinnati plan, vice versa. So they're essentially 2 different products, but we have the same portfolio off exchange in both markets for ICHRA members. Again, as typical with Oscar in Ohio, they're all EPOs, no referrals ever needed. And this goes to where I'm going with what you asked here too, whether it's New Jersey and these other markets. we are building these plans with ICHRA in mind, right? With the employee in mind. So how the plans are named, the naming culture of the plan is different than our typical gold elite plan that an employee has no clue what that means, right? It's going to be a gold 1500, a gold 3000, has the deductible in the name like a typical group plan does. We're going to have HSA options as you see here. So typically Oscar on the IP side, not really seeing many HSA options across our markets. With ICHRA, that's a different story. And then, of course, you see access to the networks that we have in Ohio mentioned here. But just wanted to quickly touch that. That's expanded. Of course, our typical portfolio is going to be mirrored as well. But really, just going to give a go ahead.
Oh,
Yeah.
quick question. So you've got the Cleveland Clinic plan in Northeast Ohio. Now, the Cleveland
Yep.
Clinic has locations in Florida. You know where I'm headed with this. Can
Yeah.
someone, a snowbird going to Florida from Cleveland area, can they access the Cleveland Clinic in the Florida setting or not?
Yeah, typically it's just within the service area that we have.
Okay.
There will be, I'm not going to say there won't be exceptions made. I've seen them be made. So you can take that with a grain of salt, of course.
Okay.
But I've seen exceptions be made because it's still the Cleveland Clinic and the TIN that they bill under, right? So as long as, pre-auth and an exception can be made, that could happen. But typically I would with how Oscar operates, I would keep it in the mind of as an IFP carrier, it's where the service area is in the state that the plan you're offered as
Okay.
of today.
Okay.
And that's a great question, Jeff, because at the end of the day, too, there's a lot of things that we're doing with ICHRA in mind going into 26 and beyond. As you can imagine, we're already talking about 26 plans, and one of those things is network. Does bringing PPO products to market for ICHRA make sense? Does reciprocity within our networks for ICHRA
Mm-hmm.
make sense and across the portfolio? So those are conversations that are being had today, and hopefully can drive a more competitive product down the line as well.
Absolutely. Thank you.
So yeah, great question. I'll jump back quickly just for a quick look here. As I mentioned, there's plenty of these ICHRA platforms out there today. You'll see some of that ecosystem on the left-hand side here. I'm working with all of them, or a majority of them today, to do different things because they all kind of hit employer targets in different spaces. They work with agents and brokers to do different, to meet different needs because it varies obviously by how you run your book of business and how this platform works. So really what I'm doing with them is, creating education, driving awareness of ICHRA, right? But at the end of the day, making sure that our brokers have access to proper vendors that are going to make sense. But at the same time, I want you all to be able to take a look, work with Cornerstone, understand, hey, who makes sense for our business to work with if we are really going to get ingrained in this model. So there's plenty of options there. I just want to highlight that's something that Oscar is doing, working with all of these to say, hey, what are we doing? How can we improve? How can we make this experience great for the employer, the employee, and our brokers? And so that's what I do a lot on the day to day. So I know we're going quick here, but I want to make sure that I don't waste anyone's time during this time of year. So, so jumping into portfolio, this is going to be more so directed into the individual market as well. Again, this is still going to relate to ICHRA as well. But this is the way Oscar operates on the marketplace or, mirrored off exchange for how the plans are named that are not made for off exchange only. So the plan suite are going to have your basic plans, right? We all have standard plans that we're allowed. And then, MBPP rules say we can have a couple plans in each metal tier. So we have our simple plans, our classic plans, and our elite plans. As you see there, it kind of highlights like whether they're copay rich or not, and where you'd expect them to land in the budget. When it comes to Ohio, we did have an expansion. As I mentioned earlier, we expanded into about 60 new markets this year. We went into 9 new counties in Ohio, so we continue to expand the footprint here. We're hopeful to continue that moving into 26 as well. It's not a huge addressable market in terms of the counties we went into from where we were in 24, but wanted to at least highlight it so you're well aware of where we're at. The green is going to be the expansion markets. I know I talked to Brad Jeff a little bit, just wanted to highlight because now obviously pricing's locked in and final. We have some very hot markets in Ohio this year, especially when we're looking at the IFP space. And again, this is going to relate to ICHRA in terms of just understanding where we land price position point wise. So we do have, $0 plans in bronze. We are the $0 plan in silver in Columbus. We have the top 4 plans in the silver rank. We have the top 3 plans in bronze in both of these rating areas. So definitely came in pretty favorably in these markets in 25. So definitely you're going to see Oscar on the spreadsheets for sure, and wanted to just highlight that here. So if you're not seeing it, you understand where you'll see it most commonly. In the other markets that we're in, we do have some competitiveness as well, but just want to highlight as you see, we kind of run the top 3 in both these markets in the bronze, and then top 4 in silver. Cleveland, of course, with the Cleveland Clinic, it is a higher unit cost, so we're not going to be the top 3, unfortunately. But obviously, those members coming from the group side, especially that have the clinic and need to keep that, are going to find a home with Oscar. So, getting into the plans, and I think this is where Oscar drives a lot of value outside of the member experience we provide, but just the plans we continue to bring to market. I think on the right hand side is a brand new plan we brought to market in several states, Ohio being one of those, that allows members who are managing 3 of the most common comorbid conditions in the ACA today, a plan that's going to really help drive affordability within the plan. Now, the plan premium might be a little bit higher than a typical silver plan, but as you see here, there are a lot of benefits that come along with a plan like this that are going to drive affordability throughout their healthcare journey with us. So as you see, $0 PCPs, $0 specialists when they're seeing specialists that are fit for that condition. So endocrinologists, pulmonologists, cardiologists, things like that. You see the $0 labs and things of that nature. These are all things that are going to help this member and these members that are actually high utilizers of their care and accessing their health plan to drive affordability. And at the end of the day, this plan will end up being quite a bit cheaper than the typical plan. If they're looking at, who's the price leader, this plan, if it's a price a little bit higher, it's still going to drive up savings to these members. And that's the goal behind these plans, but it also drives the ability for them to engage with us. We can make sure that we're providing the proper care to them. We're guiding them to the proper care. And again, Oscar is about more than just, populating a plan, having members enroll and see you later. We want to make sure that they are managing their care properly. And ideally, we have a client for life, which is a beautiful thing about ICHRA that I think a lot of us will hopefully see the fruits of down the line. But if a member is able to be enrolled with Oscar and they switch their employer and that other employer offers an ICHRA and they can keep Oscar and whatever carrier they're with, that drives us all to live a healthier life, right? We're actually accessing care. The carriers have the members actually understanding what they've been doing day in and day out and understanding how they can help them drive their healthcare journey. And I think instead of the jumping back and forth just to drive a renewal down every time an employer gets one, I think the ICHRA model allows us all, whether it's from the member, from the employer, from the carrier, from the broker side, it can drive us all to live a healthier life at the end of the day, be on plans that make sense for our family. And I think that's an interesting dynamic, the portability of the plan, that could drive some stickiness down the line as well. But again, there's a lot of work that needs to be done here.
That's
So
great, Andy.
yeah, I think it's one of those things too that's just another way to show that, hey, we're innovating in the plan designs directly to the member, right? Rather than just trying to offer that one size fits all approach. Like, we truly are looking at plans that fit folks that are actually utilizing the care, and that's the goal here. Because this was mainly pointed at ICHRA, I didn't want to only highlight the Ohio network. So obviously you'll see Mount Carmel, Cleveland Clinic, UC Health, like those are the main facilities you're going to see that we're partnered with in Ohio. But I wanted you to understand that we have obviously top network partnerships across our markets. When you look at UHealth and Vandy and things, Emory, things of that nature. So if you are working with employers that have employees outside of Ohio, we do have networks that are going to make sense. So that was a quick look here. I know it seems weird, like why you have UHealth on here, but it's focused more so
And
towards the employer.
I was just going to ask you, Andy, because I've been thinking about it. So many of the brokers we have on with us today are multi-state sellers. So
Perfect.
I was almost hoping you had some hidden slides. If we have enough time at the end, we can maybe add, if you can unhide a couple of slides for other states. And
Yeah.
for the brokers on the line, go and find the question box and type in a state you'd like to see, and Andy will do us a small and show it to us.
Yeah, we certainly can do that. I
Cool.
think,
Awesome. Thanks.
yeah, no, that's exactly what I want to do here. Just and two, a big thing is like let's keep it as informal as possible and just make sure we're actually getting the value, especially this time of year. We don't want to be spending time with any extra fluff. So,
Yep.
quick look here. The prescriptions I mentioned here, $3 prescription list across our portfolio for the most part helps to drive obviously more savings for the members. There are some branded insulins on there that can help on top of already diabetic plans we have in place and things like that. But then that search tool right there is at the URL. You don't need to be signed in as a member to utilize that. And you can check the network for, whether it's a specialty or a provider's name or a facility's name. You can search that yourself. Quick look here, partners we have, PBM being CVS Caremark. You'll see on the IP plans, pediatric vision is through Davis. The other thing I'll point out here is the labs. Of course, we work with Quest and LabCorp, so preferred lab vendors gives you a choice there, which is great. Covers most access we need. So again, quick highlight into the portfolio, not just ICHRA-wise, but into the IFP space. Definitely competitive in Ohio for 2025 in certain markets, and we're going to continue to drive that. I don't want to beat this down, especially if you've been on an OSCR webinar, already this year or anything like that. But really, these are what's going to help drive that member experience that we have, that MPS that I talked about earlier. Award-winning mobile app, right? Your members can do everything they need. This is OSCR's been built from day one on our tech, right? Our tech is our own. It's built by us for us. So our app is our own. We're not waiting on a messenger to fix anything. We do everything ourselves. So not only is the app like that for your members to do everything they typically need to do, but that's how they access their virtual care with us. So within Ohio, we have virtual urgent care. We have something else called virtual primary care. Unfortunately, not in Ohio today, but it is in many other markets. So many of you folks, if you work in multiple states, you will experience OSCR primary care. Essentially, it's the same thing as the virtual urgent care, except for without getting a call in 15 minutes to handle whatever you need here and now. You actually can build a real relationship virtually with a primary care doctor within OSCR Medical Group, also a $0 service. So these are ways, again, to get folks access to care when and how they want to use it, and all done within our own proprietary system. And then within this mobile app or online account, however the members want to access, or of course calling, they have access to their care team. So if you've heard me talk before, I'll kind of boast on these folks that help drive our member experience. When your folks call in, that phone number that they have on their file will route them through the phone tree directly to their care team. So Ohio Care Team 1, right, is going to get access to, this member is going to get access to that care team every time they call in. Same 4 to 5 people typically, that can help answer, and a lot of this is going to take, functional questions off of your hands, right? As the broker, the care team should be able to handle like, hey, is this person in network? Or can you help me find a PCP that's in network? Or what's this bill mean? Or this, that, right? They can do all that, no problem. And then there's also a registered nurse or nurse practitioner on that team as well. So let's say someone did get newly diagnosed, right, with something, and they really just don't know what to do next. That call is going to mean something because we actually have someone with medical expertise to be able to help walk them through, walk alongside them. And then, of course, at the end of the day, some high utilizers or they're dealing with a true condition that, needs some true walking alongside you. We do have case management folks that are going to help, those members every single day. And the difference about OSCR, right, is that we're not only putting these case managers with high utilizers in a large group, right? We want to make sure that large group's happy, right? No, we work with individual members. That's what we do. That's our A team is always working on the IFP plan, right? We're an ACA carrier. We don't have Medicare Advantage. We don't have a group product anymore. The group chassis of ICHRA brings folks to the individual product that we offer. And so our A team is working on our individual member product, every single day. So when I say that, the big thing I'm going at here is we want members to engage, as I mentioned earlier. So when you are working with us, make sure to try and get your members to create their accounts, get the app, make sure you're getting the extra info, as I mentioned, like their phone number. I know all carriers don't necessarily ask for it. We want it because that helps us drive this experience, right? Their phone number routes them directly to their care team. So we just want to make sure we're doing that and we're engaging with your clients. To make sure they're happy, but also to help, ease up your workload and make sure they're coming to us with those functional questions or even escalated questions. We're able to take those off your plate and say, hey, we handled it, and your member's happy. So that's the goal. 95% of our business plus is broker driven, right? We're all about the broker. That's how our distribution model works. And so we want to make sure we're doing what we can to support you, build tools, work with your members, things of that nature, which will get us right into the ending here. If you've worked with us, the top URL here. This is going to be, you'll never be waiting on Brad or Jeff or myself. If you need something from Oscar, this link will have your plan grids, your network overviews, your marketing one-pager PDFs. Like, hey, what is that CKM plan Andy talked about? I can't remember. Did it have $0 diabetic foot and eye exams? I can't remember. Well, there's a PDF for that, right? So kind of like that, saying there's an app for that or whatever that was, right? It's everything's on this broker resource website. So you can access that. You don't need to sign in or be in your broker portal to get access to it. It's public at all times. And then of course you see broker support. If you need anything, obviously Cornerstone, go that direction. If anybody needs anything from me, you'll see my contact here shortly. But really, we want you to be able to talk to real people. We want you to have the tools that make sense for you to actually serve your clients best. And that's what we continue to try and provide and update as we go into new toolings. When it comes to ICHRA, and of course, this is the biggest thing here for me, is that 90% of the folks that enroll in an ICHRA want to enroll off exchange for the additional tax benefits of doing so. If you are enrolling off exchange with Oscar, we have our own off exchange enrollment flow that helps you enroll members that direction in 2 minutes or less. Really, you'll work with an admin or vendor for most likely compliance and quoting the ICHRA and doing that design and things like that. Some of them, do everything for you. Some, you're the BOR and you continue things yourself. So if you were to enroll, you would have access to this. This is only for ICHRA members. We don't just allow IFP off exchange enrollments today easily directly through our portal. So, that's something that we continue to discuss and think about down the line. But really, this is intended for ICHRA enrollment, but all of that's done within our broker portal. So we have our own flow for that. And again, we continue to update this. So you can now bulk email your book of business. You can filter it by like overdue premium. It'll show you who has that. You can click bulk email, and we have like canned templates for you to be able to just send that out to your members to say, hey, just a friendly reminder to pay your bill. And obviously it'll go out to, the 60 people who haven't paid their bill, and you just had to click a couple buttons. So that's another feature we added this year that hopefully can help drive, more time back into your hands. So I'm going to wrap it up here. I know I've been talking and blabbing, but again, I don't want to add any extra fluff here. So, at the end of the day, we're a carrier here to stay, right? We continue to bring new products, and we want to, again, I love that saying of keeping one hand in the present and one hand in the future. And I think we're doing a great job at doing that. And I think we're going to continue to innovate on our products. We love to hear from you all, good, bad, and different feedback-wise. How can we be a carrier of choice for you, not only for the individual market itself, but also for ICHRA? So, if you're working with an admin, you have questions, or you've got some feedback from me on who you've been working with, or, heard from, or this or that, I would love to hear it. I would love to connect with you to make sure that we're doing right on our end on both of our products. Initiatives here. And I know Cornerstone's the same way. So however we can work together, I'm of course all ears. So quick look at my team if you want to screenshot this. But that's I'm going to wrap it up there, and
Yeah,
can
Andy,
answer
and no,
questions.
awesome. And I didn't want to interrupt a whole lot because you had some great flow going, and it was like I like to do it, really concise,
Yep.
and getting to the point. And for everybody on the call, I really forgot to say that Andy is standing in for our normal regional rep, and that's why he covered some of the sort of the on exchange items too. Because when we had Jared on, it was probably about the end of August, and there was a lot not known. So I'd asked Andy to do a little bit of an overview, and he was filling in for Jared Wasley, who is our general rep. And we met Andy last year at our expo here in Cleveland, which was really great because it was really kind of spot on. The CE was about ICHRA. We had our brand new ICHRA specialist, Lael Reitler, was on hand as well. And that's a thing to also share with you. If you're just venturing into this ICHRA thing, you're not going to do it alone with Cornerstone. Um, we can we can lay out. We can help you at any level you want. If you want to be fully involved and you want to do the enrollments, great. If you need help just getting started, Lael can help you with that. So lots of great options. I have probably talked to about 10. Andy, show the platforms again.
Yep. You
um,
bet.
I have everybody beating down our doors that wants us to show us their
Yeah.
platform. So we are working with two of those. NextBen for the longer term, and we started working with Benefit Bay. But I've heard from Venture, I've heard from LifeRaft. You have to be careful with some of these guys because some of them want to be broker of record. So it's important to not to own more than just the relationship, is to own the full commission, is to own everything that comes with it. So if you're going out on your own and you think you're going to get with one of these, just talk to us or Lael because it's important, right? For you to maintain your revenue stream. That's our revenue stream as well. So I wish we would have had Lael on. I didn't think of that, but um, so in tandem with what Oscar and Andy are doing, it's a really good platform. The platform, Andy, do you have like 5 minutes to maybe show a quick demo of what the platform looks like or not? Or is it way
Our
too involved for this early in the morning?
Yeah, no, really it's our enrollment process. I have a demo video, so let me send that
Oh,
out
perfect.
with
The
our
follow-up.
presentation. The only reason
Yeah,
I made the demo video because it's hard. I don't have like a staging. I'm not an engineer, so I don't have a
got it.
staging deal. So I don't want to be
Okay.
able to pull up any PHI or anything like that on here. So
Yep, got it. So there are a couple of great questions. And while
Could
you're
I?
at this slide, go back
Yeah.
to, hang on, Jeff.
Okay.
Go back to the chronic care slide, please.
yeah, you bet.
And
I think.
those are really great plan options, by the way. And so being asked, are the chronic plans off X only or are they on exchange also?
Yeah, fantastic question. They are on exchange as well. So in the markets shown here, on the right hand side. So Texas is just on our. We did offer. I didn't mention this today because I didn't think it was relevant for this audience, but it really does show Oscar's continuing to innovate. Though we did offer our first actual gate kept HMO in 2025. So we're doing that in Georgia and Texas. So actually, instead of going the PPO route that I want to go for ICHRA, we actually have a lower price point HMO that's gated, but using our technology to really make it seamless. So that's what the Texas asterisk is there. So that is available there. The other states, it's available on and off exchange. I will tell you, in Georgia, if you do right in Georgia, you guys, you won't see it called chronic care. You'll see it called multi-condition. So just so you're aware, it's the same exact plan. It's just called different in Georgia. So
Okay, good. Jeff, before you ask your questions, let me get in another broker question. Can you give a brief overview of how Cobra works with ICHRA from a compliance? I got to open the whole thing up from a compliance standpoint. Kimberly,
Yeah,
that's a really great question. That's a good hardball one.
yeah, that is a very good question. So, and I usually don't get too in the weeds with the actual ICHRA, Cobra or tax questions as a carrier, but I will tell you that Cobra does still apply, of course. However, typically, if you're working with one of these vendors, a lot of them, help the compliance and understanding the admin abilities there. But Cobra applies to the ICHRA. But at the end of the day, if the member is going to continue to have the employer pay for that and then reimburse the employer, or the beautiful thing about ICHRA is they strictly just portably take the plan and they continue to pay on their own. And at the end of the day, that's the most common route, right? Is they continue to keep their plan and they kind of walk away because also the employer isn't going to charge the 2% that they could charge on top for their admin, right? So typically the employee would just take their plan and they would continue to pay for it by themselves outside of the platform directly with the carrier. So that's the most common thing you're going to see. When it comes to the compliance of it, you'll want to work with obviously the vendor or admin to make sure the proper eligibility notice is going out and things of that nature. But so it applies, but it's like kind of pseudo compared to what you're used to on the group side, because typically the member just keeps their plan and pays for it direct.
Yeah, that's the ultimate in portability. That's interesting. I didn't really think about it like that, how ICHRA solves that problem. They just take it with them if they
Yeah,
want.
exactly.
Right?
So it still applies, but it's kind of like, take that with a pseudo
Yeah,
look is how I
yeah.
look at it.
But
So
but so if they're not going to think about it, if they're not going to get the reimbursement from the employer, why aren't they just going to go on exchange and now be eligible for a subsidy potentially, right?
yeah,
So there's
they
nothing
could do that too. They give them
Yeah,
a
there's
QLE to
nothing
do
to
that. Yep.
mandate that you have to stay on a Cobra. Most people choose not to if they have any druthers about it. Sometimes they can't, maybe for a health condition and such, or a spouse or children, that they need to stay on it because it's a richer plan that they can get.
I think
Than
Brad, that's a good point. And I think there's a misconception there too that on why folks would want to go off exchange instead of on exchange. And obviously there's the employer contribution would be a tax-free contribution, but the employees portion, if they are contributing, would be tax advantaged. If they go off exchange, it would not if they went on exchange. So it makes sense for employees to go off exchange, but some people are like, but if they go off exchange and they leave the company, they wouldn't be able to get the subsidy because they're off exchange. Well, in reality, I mean, they could just re-get that plan on exchange because they now have a QLE because they're now, eligible for subsidies that they weren't prior, right? So that is a QLE. They're going to get access to just go get it. I get it's an extra step, but it's one of those things that let's just make sure we're aware that, hey, it's going to benefit them better this route, and then they could still get that access if they needed it down the line. So it's not like
right,
they're screwed out of it. So yeah.
yeah, good. Those are all. And so, gang, as I asked before, if you have a state map that you'd like to see, that you're maybe looking at some cases in other states, while Jeff is asking questions, Andy might be able to pull up some of those other states. So just type them in if you want to see uh, Texas or Florida, what the maps look like. It's a good time to do it while we've got Andy on the line.
Okay. Andy, I just want to revisit your ICHRA portal and how that compares to your typical off-exchange
Um,
channel.
yeah. So how we enroll off exchange?
Well, I mean, you've got your specialized ICHRA portal, and how does that
Yeah.
help me understand, where that
So
fits in?
yeah. So really, it's not. I don't want to make it sound extra special than it is, I guess, to put it. Really, what it is you need to your NPN needs to have ability to write off exchange ICHRA with us to be able to access that flow. Otherwise, you're only going to see off exchange plans in select markets. Ohio is one that you'll see off exchange plans if you're just enrolling in our direct PDE. But like for Iowa, for example, you would not see our off exchange plans in our broker portal. It would push you on exchange each time because we don't lean into off exchange only IFP plans. So typically we only allow off exchange enrolled with us through an ICHRA. Otherwise, it's a clunky process to do that. So, and the reason why we kind of make the NPMs able to do that is because a lot of these platforms are the ones enrolling on behalf of members, or if there's brokers who are working with a platform that does X, Y, and Z, but they continue to enroll, we need to know that, and I can make sure your NPN is available to do that. Because again, we want to keep it to ICHRA lives. There's a lot behind that on why that is. Hopefully down the line, it is what it is, and everybody's enrolling on and off exchange however they please, but that's how it sits today. So the portal again is directly through their broker portal. Most of you probably don't have access to it today. I mean, Cornerstone would, but that's something that if you are writing ICHRA and you need access to write off exchange in every single all 18 states, shoot me a message and we'll make that happen. So
Okay, so just to be clear, it might sound silly, but if you want to write off exchange for Oscar, you need to go through this ICHRA channel. Is that what you're saying?
yeah, it's really just like an off exchange enrollment flow. That's all it is. We just
Okay,
have it
okay,
set for ICHRA. It's not
I
ICHRA
got it.
specific. It's just off
Yeah,
exchange.
there are
Um,
circumstances, and I'm just playing devil's advocate here. There are a lot of folks that want nothing to do with on exchange. There's
Understood. Yep.
issues with that. They want strictly off exchange. Some of them don't. Some agents aren't certified to sell on exchange. So
Yeah.
that clarifies that for me and kind of allays some of the questions that I had. If you don't mind, I got a couple more questions.
Yeah.
And don't look for slides, Andy, because nobody's asking for additional states. So,
All good. Sounds good.
yeah,
okay,
good.
and
Yeah.
and of course, this is only going to show um, Oscar plans, the ICHRA portal. It's just your off exchange channel. Um, and then, what's the typical profile of the ICHRA adopter? In other words, the employer or the group. What's the size? What's the industry? And
Yeah.
we're all about prospecting here, and we want to maybe
No, it's a
pivot
great question.
towards, different. So a lot of these guys, are maybe just individual brokers, Medicare brokers, but this is a great opportunity for them. And just help us understand how to prospect for these ICHRA cases.
So, and you bring up a good point with that comment. So I think that I'm going to take this in two ways. The first is that I think an employer or the typical employee benefits broker has the advantage in terms of they have the groups, right? They have the groups that they work with that they can bring this solution to that makes sense or might, it's not going to make sense for every group in your book. I can guarantee you that, but it's going to make sense for some in your book. And then you have the other aspect of where the individual broker has the advantage of they're an expert in what they write. They're an expert in the ACA. They understand the carriers that are available in the plans and the networks that are already in the space, right? And most of them work with groups here and there, right? They don't have the full list of groups that a typical employee benefits broker does, but there's advantages on both sides, right? So I think it's a solution that's going to fit, the brokers on either side of that aisle, and it's going to help merge that a little bit down the line for folks to be able to access more solutions for more clients and just be more of an expert on what they do. So I think that's a good point that you bring up. And then two, I would say when it comes to groups that it makes sense for, we're seeing more and more larger groups transition to this model mainly because you can capture larger savings, right? It makes sense when the numbers get that crazy. It's like, we got to look at this. It only makes sense. Our risk profile self-insured is just not cutting it. We continue to get double digits, 17, 18 points, 20 points, whatever it is. Like, this is not sustainable. Let's take a look. And then they see $1 million in savings and they're able to, fully fund, gold plans and this and that, like, right. So we see it more and more common for larger groups. Now, I will tell you in Ohio, it's across the board. Small group, middle market, large group, like everybody's looking at it because of where the rates sit in the individual market versus fully insured small group, up to 250, and then level funded, where rates start, things of that nature. It looks good in Ohio across the board. So it depends on market. and I know it's kind of going around it, but it's true. It depends on the market you're in. But the largest adopter right now are going to be larger groups. So your 250 plus are actually getting more, which everybody thought it was a small group solution, but really QSERA brought that forward, right? ICHRA really can be for anybody. I think the notion I would put there, because I'm the carrier, I'm not an ICHRA admin, I'm not a vendor, right? From the carrier perspective, and I see this, it depends on the size of the group and where admin fees sit and what makes sense for the group at that point. What are they willing to put forward? What's their contribution look like? All that plays a factor in what's going to make sense. So that's the roundabout way of saying we're seeing it across the board. When it comes to businesses, I think what I continue to see are, employers that it really makes sense for are distributed workforces for sure. Two is groups that have like per diem employees, or maybe it's hospitality or restaurants and things like that. Like, it's making a lot of sense for those groups who haven't offered coverage and are looking to do it in some way, shape, or form. This is a great way to do it. Again, any group that's just continuing to have troublesome renewals and they're like, this is just not going to cut it. We got to find a new solution. And I think this is where prospecting for everybody here, like, you can be the one that everybody's talking about. If you're not doing it, someone else is, and they're going to be going after your clients. You could be that broker that is actually showing this to folks and being like, hey, it's a solution. You need to take a look at it. It might not be the fit for this year, but let's run an analysis to see where we sit, and then let's reevaluate for 2026. And I see that every single day. I think that's the most common route today because it is the buzzword, right, of this industry. It has been like this last year. Because people are actually seeing the value really come from it. And I think that's only going to continue as more carriers get involved, more big houses, and brokerages are getting involved, and we'll see what that looks like. But yeah,
And you
I think
touched on
across the
something
board.
else briefly. You mentioned QSHARA. I get that quite a bit. Why are you not maybe offering this for QSHARA as well?
Yeah, I mean, so QSAR is a little bit different, and because there's limits in terms of what you can contribute to the employees. It's a great solution for small groups under 50. Obviously, ICHRA can fit any size group, which is why it's kind of taken put QSAR in the shadow. But QSAR can still be a great option. There's just a little bit more guardrails around QSAR than there is
I
ICHRA.
agree.
I mean, that's
Yeah.
really the best way to put it. But
Yeah.
outside, I mean, it still can be a great option. So
Mm-hmm.
it's just another chassis to go through.
Yeah. And Andy, I think how we've always joked about since we've known each other that ICHRA had a 400% enrollment year over year. This might actually be the year where it's going to be more of a real number because 400% of 10 is just 40, right?
Yeah.
So it's going to be the word's getting out there. There was one of the brokerages that was on the call. I think maybe they had to step off, but they stopped just for the others. They stopped selling self-funded and fully funded and have reverted just to selling ICHRA. And they're having great success because he's got a large office of staff that are all doing it. I need to work on them for the processes, but they've got it figured out. But it is becoming a solution. And I've always stood up and said, look, everybody wants a silver bullet. And if you're going to lose a group and they think they're going to go to a different broker, this is your silver bullet, right? And because what's going to happen? What's going to happen. You quote groups all the time. They're going to go to and find another broker. Maybe it's somebody they know. And they're going to find out that it's not going to be any different because guess what? The quoting system for fully funded and self-funded, it's kind of public, right? It's all the same. They're going to go to the same carriers. There's no other carrier they can bring. They're not going to bring Blue Cross Blue Shield of Montana in for an Ohio plan or a Texas plan. So they don't understand. So this is your one opportunity to save the group that you're this close to losing. So, and sorry that I'm preaching, that I sound all preachy.
No, you're right. I think, and that's the beautiful thing about ICHRA. It allows folks to find a plan that meets their needs as a family. And I think, I look at this every day as like, I need the other carriers doing the same thing, right? I need them to be investing in the space. I need them to make educating in the space to make sure people understand like this is a viable solution for a lot of groups. And at the end of the day, it's going to help folks out down the line. So
Yeah,
cool.
great. Andy, thanks. We're at time. I don't want to keep everybody. I'm not seeing any additional questions, but I think I have an idea. So as I messaged you yesterday, I have an idea for our expo next year, and I think we're going to do a roundtable discussion. And I think you're going to be leading that roundtable discussion on ICHRA. So I'm still developing it. So know that you're coming in, and please tell Jared to not be put off that I want you here. I actually want you both, as I said yesterday. So if you're willing to come to Ohio, we'll try and make it worth your while.
All right, man. Appreciate you
All
guys.
right. Yeah.
Thank you,
Thanks,
everyone,
man.
for
Have a
joining.
great weekend. You got it. Take care. It's not the weekend yet. Why do it seems like it should be Friday and it's only Tuesday.
Tuesday.
Yeah. So, all right. Have a great rest of the week, Andy.
Thank you.
Thank you,
Thanks,
everyone,
everybody.
for
See you
joining.
all.
Appreciate your engagement. Take care. Thank you. Bye.